Hello, I'm Dr. William Streck, President of the Bassett Healthcare Network, and I'm here to provide an update to our community and our region in regard to the COVID pandemic that is so affecting our lives. I want to begin, however, with a note of thanks to the emergency personnel and first responders who came to the Bassett Healthcare campus last evening and provided a serenade of sirens, horns, and noise. Respect resonated across the entire Bassett Healthcare Network that have been involved in managing this particular social event. It was a touching event, a real tribute. The staff of the hospital came out to applaud in turn those first responders and emergency personnel who have been so much of a contributor to this process as well. But it just emphasized that we are in this together. There are many of us in many ways involved. And I think I could offer the thought that that cacophony of sirens and other events last night symbolically, in a way, ended the acute emergent phase for now of this COVID problem. Because we have seen a downturn, and we are now moving into what we might call the adaptive phase, where we are still under order to socially distance. Our businesses are closed, our schools are closed, and yet we are looking for ways to move forward. We have, from the government, 4 general ways to outline our progress. So as we attempt to unroll the limitations that have been imposed, we have to look for 14 days of declining disease evidence. We have to have health systems that can handle all patients without a crisis mode. We have to have adequate testing, and we have to have adequate surveillance. If you look at those 4, one we can address right now, and that is that the Bassett Healthcare Network is capable of full service to patients without a crisis mode. We have, even through this crisis phase, continued to offer services. But now we're ready for the next phase. And what is that next phase? Well, first of all, we can now provide elective surgery. That's a first incremental step forward. But basically, we are now preparing to offer all the services that have historically been part of the provision of care in this region. Now, that will occur, but there will be changes for our patients. We will, for instance, offer a video visit if someone prefers that. But we have established, and this is very important, through this crisis phase and now beyond, that we can offer safe, effective care at all sites in the Bassett healthcare system. And this will become apparent as patients come and see even enhanced safety procedures such as the use of screening, temperatures, masks, different protocols. The point of all this is that the hospital, the health system, and the components of the health system have become a safe haven as we progress forward. Having said that, I have to emphasize as well that we are but a component of our societal adaptation that's going to move forward. We can offer a building block. With additional testing and the plans we have put in place, patients can resume the patterns of care that have been important in their lives. But we are part of a broader picture, and part of the success of our region has been not just Bassett's screening and effective management of the disease process, but the social distancing and the social responsibility demonstrated by the residents of our region. So we are all in this. And moving forward, we have one component, that's Bassett. I can speak to that. We can provide services. And we will, in fact, provide more services as we look for ways to benefit businesses, schools, institutions, where questions about testing, questions about protocols, questions about information will continue because COVID continues in our community. So we are a good base upon which to build. We will be offering more, but we do all of this very, very cognizant that we are one part of a societal adaptation. We will try to do our part, both as healthcare providers and citizens, and we will do this in a journey together. Thank you.